Welcome to the January 2024 SNHD protocol update. On January 10th, 2024, the Southern Nevada Health District released its new protocol manual that replaces the June 21st, 2023 version. In order for an agency to use these protocols, the agency must have 90% of its providers complete this training. An overview of what is in this protocol update. EMTs can pursue EMT IV endorsement. There are updates to the trauma field triage criteria protocol. The adult cardiac arrest pearls now allow for mechanical CPR devices. Westcare was removed as a patient destination. MountainView Hospital was removed as an NIR-capable facility. Dopamine has been removed. Phenylephrine has been removed from the adult bradycardia protocol. There has been an addition of push-dose epinephrine to the adult bradycardia and pediatric shock protocols. Push-dose epinephrine dosages have been standardized. The CPAP protocol has been renamed to the Non-Invasive Positive Pressure Ventilation Protocol. Sodium bicarb dose was changed in the Adult Hyperkalemia protocol, and atropine dose was changed in the Adult Bradycardia protocol. EMTs can now apply for EMT IV endorsement. An EMT IV allows the EMT with the IV endorsement to have the knowledge and skills to cannulate peripheral veins under the direct supervision of a paramedic or EMT. The key being that the EMT is under the direct supervision of the paramedic or the AEMT. The process to become EMT IV certified, the individual must be currently licensed or certified as an EMT. They must apply for EMT IV endorsement through the Southern Nevada Health District, and they must complete the SNHD, Office of Emergency Medical Services and Trauma Systems approved training to include indications, equipment needed, techniques, possible complications, and general principles for peripheral cannulation. They must describe and perform disposal of the contaminated items and sharps. Psychomotor objectives to include proper use of universal precautions, demonstrate cannulation peripheral veins with clean technique, and proper disposal of sharps. In addition, the individual must have 5 successful sticks, either live or simulated in a laboratory setting. The applicant will be given 6 months to complete this process. There are some restrictions for those holding an EMT IV endorsement. These restrictions include being able to only cannulate peripheral IVs. The EMT IV is not allowed to cannulate external jugular veins. They are not allowed to use interosseous needles. They are not allowed to perform the skill on pediatrics. This skill must only be done under the direct supervision of a paramedic or AEMT. And lastly, the EMT IV cannot be the primary care attendant on the call. In addition, the agency must agree to 100% chart review for any EMT IV skill. The next update is to the trauma field triage criteria. As you will see, there are overall layout changes to align with the changes issued by the American College of Surgeons Committee on Trauma, moving from 4 steps to red or yellow criteria. Step 1 is now changed to red mental status and includes the following changes. Change of GCS less than 13 to GCS motor less than 6, and change in vital sign criteria based on age. Step 2 has been changed to red injury criteria and includes the following changes. Change from open or depressed skull fracture to skull deformity or suspected skull fracture, and change from paralysis to suspected spinal injury with new motor or sensory loss. Step 3 is changed to yellow mechanism of injury with the following changes. Falls are no longer differentiated by age, but are now grouped as falls greater than 10 feet, and the miles per hour requirement for mechanism has been removed. Step 4 is now yellow judgment and includes the following changes. This section is no longer mandatory, but is instead at the judgment of the provider. Antiplatelets and anticoagulants have been added as a consideration, and burns are transported per the burn protocol. There are no changes to the catchment areas. Patients that fall in the red category shall be transported to UMC or Sunrise Trauma Centers. As a review of the catchment areas, Sunrise's catchment area is Sahara to the north, Paradise to the west, the county line to the south, and the county line to the east. Anything not within that area goes to UMC Hospital. Patients that fall in the yellow category should be transported to UMC, Sunrise, St. Rose Sienna, or Michael Callahan Military Medical Center Trauma Center. As a recap to the catchment areas, Sunrise's catchment area is Sahara to the north, Paradise to the west, County Line to the east, and the County Line to the south. St. Rose's catchment area includes all of the city of Henderson and Sunset Road to the north, Maryland Parkway or Paradise Road to the west, the County Line to the south, and the County Line to the east. The catchment area for Michael Callahan Military Medical Center includes North 5th to the west, Lake Mead Boulevard to the south, County Line to the east, and the County Line to the north. There have been some changes to the adult cardiac arrest pearls. The adult cardiac arrest pearls were updated to allow for the use of mechanical CPR devices on pregnant patients if these devices were approved for use by their manufacturer. CPRs follow a pit crew approach with roles assigned prior to arrival whenever possible. Westcare has been removed as a patient destination. MountainView Hospital has been removed as an NIR-capable facility. Dopamine has been removed from all protocols as well as from the EMS formulary. Push-dose phenylephrine has been removed from the Adult Bradycardia protocol. There are some updates to push-dose epinephrine. First of all, push-dose epinephrine has been added to the Adult Bradycardia and Pediatric shock protocols. Push-dose epinephrine has been standardized in all adult protocols to 10 micrograms, IV or IO, and push-dose epinephrine has been standardized in all pediatric protocols to 0.1 micrograms per kilogram, IV, IO to a max of 5 micrograms. The CPAP protocol has been renamed to the Non-Invasive Positive Pressure Ventilation Protocol to allow for the use of both ventilators equipped for BiPAP and masks that can be dual utilized for CPAP and bi-level ventilation. Sodium bicarbonate in the Adult Hyperkalemia protocol has been changed to 50 milliequivalents. The atropine dosage in adult bradycardia has been changed to 1 milligram to align with current ACLS standards. This concludes the January 2024 SNHD EMS protocol update.